Pilonidal sinus disease is often a common problem that is usually referred to as Jeep bottom disease or Barber's disease, often because there used to be a tuft of hair that was found in these places. It does happen in people without a lot of hair on their back as well, and happens in women alike, just like men. It can vary in presentation. Some people do have them infected and some have it small with multiple tracts being present. We've tried to define pilonidal sinus and classify it over a period of time, and we have different classifications for it as well. The treatment for pilonidal sinus has obviously evolved like everything else in general surgery, where previously we used to be doing more extensive open wounds where people just had a raw wound that was allowed to heal, to now more advanced flap techniques that we use. We use a Limburg's flap or a rhomboid flap. We use a technique called as cleft lipped and a lazy S incision as well. For those with smaller pilonidal disease limited to the midline without any lateral extensions, we could get away with doing a small off midline closure and even minimally invasive techniques. Some patients can have laser procedures done as well, as long as the pits are very small and limited. Patients get a good result as long as we've dealt with three of the things: remove the disease, move the pressure off the midline, and essentially ensure that the recurrence risk because of hair has been removed. Here we hear from one such patient who recently underwent pilonidal sinus surgery under my care.
I've had my pilonidal sinus for about a year and a half now, and I tried exploring antibiotics, laser surgery, and then when I consulted Dr. Nikhil, he told me about the Limburg flap. So I was a little hesitant to have the surgery at first, thinking that it would be very painful. But I experienced almost no pain at all. I would say that probably the worst pain was probably a needle prick, and then my recovery, this has been 2 weeks after my surgery, and then my recovery has been great. I have had no pain so far, and I'm also flying to the US back in a week or so.